Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, Anita Finley.
Well, let's talk about stem cells, because that is, years ago, I would say probably, I don't know, maybe 8 years ago, stem cells, it was nothing. And maybe we all heard about this with the embryos, the babies. It was never what it was going to do for other people. So, but you've had a very interesting career. And I just want to, of course, introduce Dr. Feinerman, Dr. Burton Feinerman. I got away with this. I got too far away. Dr. Burton Feinerman is on our show now, and he is an anti-aging specialist. He's done a lot of things in the years that he's been practicing medicine, but he is so enthusiastic about stem cells. It's like a revolution for you, isn't it?
Oh yeah, it's what keeps me going. And it's been, as you say, it's really 8 years ago. I actually evolved into. I was practicing in Maui, Hawaii at the time, and I evolved into doing cosmetic dermatology and anti-aging medicine. And but then the stem cells got me, and I've been a fanatic ever since then. And of course, it was a learning process, because you couldn't go to a special school or facility to learn about stem cells. Most of it you had to kind of learn from your own reading from international and national journals talking about stem cells. But now there's a much simpler way for doctors to get involved with it. But the sad part about it is that doctors haven't done that. And it's such a terrible shame. There's only one group or specialty that's jumped into the stem cell arena, and that is the group of orthopedic people who have jumped into it, trying to help people avoid getting hip and knee replacements, and which the results of their treatments are far better than the orthopedic surgery that was involved with those procedures. And but throughout the rest of the world, throughout Europe, certainly every country in South America, places even in Asia such as Japan, South Korea, Thailand, and probably the most advanced country in the world when it comes to stem cells is Singapore. Singapore, at one time, their economic structure depended upon the electronic industry, and as that began to wane in terms of their able to collect revenues from it, they came up with a clever idea of setting up a biotechnology massive area in Singapore. And Singapore is not that big, but they converted this enormous area of Singapore. It's called Biopolis. And they attracted scientists and doctors, Nobel Prize winners from all over the world to come and work there. And particularly during the George Bush Jr. era, when stem cell research came down to a startling halt, that was an avenue for him to work at. And oddly enough, of all people, the other person who helped in that arena was Governor Arnold Schwarzenegger, who welcomed and changed laws so that scientists could do at least continue research in that 8-year period. And when President Obama came in, he did loosen up some of the restrictions, but we're still got our hands behind our backs, and very little new work is being done in that field.
Dr. Feinerman, let me just stop you for a moment, and I think people would like to hear some of the examples of some people that you have been able to perform stem cell therapy, and what has it done?
Well, we've seen often miracles. We've seen children with a rare disease that used to be thought to only be among the Jewish people. It's called Tay-Sachs, in which these children got a combination of stem cell and gene therapy, and where the children were literally vegetables. They began to sit, to crawl, to talk. It's a disease that also causes blindness and their vision return, and their mental functions became normal. People with so many other conditions, people with rheumatoid arthritis and osteoarthritis have responded very dramatically. I myself, I'm not exactly a young guy anymore, and I noticed my kidney function was decreasing a little bit. So I went to the nephrologist, who happened to be right next door to me, a young man, about 38 years of age. And I said, "Well, what are you gonna? What can you do for my decreasing kidney function?" He says, "Well, if you got diabetes, we can fix that." No, I don't have diabetes. Well, you probably have hypertension, so we'll fix that. I don't have hypertension. It says, "Well, that being the case, we'll just follow your kidney function test, and when they get real bad, we'll put you on dialysis." I said, "That's not a solution. That's a sentence." And so I went and had my own kidneys. I used an interventional radiologist. He passed a sterile catheter up my femoral vein from the upper thigh. Very, very simple procedure on direct visualization. And he went into my right kidney or my left kidney. And now my kidney function is not a little better. It's 100% better. It's completely normal, just like that of a young person. And I'm a young 87-year-old who now has 25-year-old kidneys.
But wait. So let's just talk about that. So explain when the interventional radiologist went and where did they get the stem cells from? Why don't you explain that?
They got the stem cells from my own adipose fat in the lower abdomen. It's just like a handful of fat, and it's then extracted. The stem cells are extracted. They're called mesenchymal stem cells, and once they get into a tissue, they turn into that tissue. For example, if a person's got problems with their cartilage, the osteoarthritis, when you inject it into, let's say, the knee, it turns into cartilage in the knee. If you introduce it into the heart, the mesenchymal stem cells will differentiate and turn into heart cells. And so likewise, the same thing occurs with the kidneys. We've done similar work. In the past, when I try to treat diabetics and just give them pancreatic islet stem cells that produce insulin intravenously, very little of those stem cells ever get to the pancreas. So we did the same principle. We just simply passed the catheter right up to the pancreas, put the pancreatic islet stem cells that produce insulin, and people who were taking insulin as much as 5 times a day were able to stop the insulin. And so, we're talking about miracles here.
Yeah, we really are. And so in Europe, I mean, you talked about Singapore, but in Germany and other places, are they able to use the stem cells more freely?
They are. You have to choose one place where they've had some problems, because there was one company in Germany that was doing things that weren't ethical and professional, and so they had a little turn down there. But places like in Sweden, in the Netherlands, and even France, you can have these stem cells there. But sometimes I'll have people that, even though they do stem cells there, they may not quite do the. It's very important to do two things. You have to give the right kind of stem cells. You notice I mentioned when we're talking about the diabetics that we actually use pancreatic islet stem cells. So it's important to use the right kind of stem cells for the particular disease. And so although you can give stem cells from the patient's own body, to try to treat some neurodegenerative diseases. I have been somewhat skeptical, despite some reports that they claim that it works that well. So when I have a person with Alzheimer's, or I have a person with ALS or Parkinson, I'll use neural brain stem cells. These stem cells originate from umbilical cord blood. We get the stem cells. The final product. We don't just simply get umbilical cord blood from an umbilical cord USA blood bank. We get the final product, and that can be obtained through academic and commercial sources nowadays. Sometimes with some of these conditions, I have learned that you can't cure or make a big difference with a patient. Sometimes you have to repeat the condition, the treatment. And so that's something that will vary from person to person. And sometimes I have learned that using some adjunct therapy, like if we talk about, say, the ALS patient, giving them hyperbaric oxygen treatments can be a benefit. And with Parkinson, often they implant a deep brain stimulator. So rather than doing that with the ALS patients or the Alzheimer's, they have some what's called a transcranial magnetic stimulator, and it's just something you apply on the outside of the scalp. It transmits the electrical impulses from the scalp right down to the surface of the brain, and you can do that, let's say, like 20 minutes a day. And so there are other things that we can do after we've done the stem cell treatment.
So, well, Doctor, I'm just going to stop a minute because I want everyone to know who you are and how they can contact you. You're listening to Dr. Burton Feinerman. He's an MD, and he is located out in Wellington. And he is so kind. He will actually, if you call him, he will give you a complimentary evaluation. Takes a lot of his time, but he's so dedicated to this. He really, you can hear it in his voice, and he's actually a student of his own work. I mean, so he's doing it himself because he believes in it so much. His office is located his office is located there at right near Wellington Regional Hospital. And if you, by the way, there was a seminar that was canceled, and I have to assume you're going to be doing another one at this point in the future to be able to have people. We don't have a date yet, but I know that you're planning on doing it because the last one you did when you were at the Marriott, you had a very nice turnout.
Right.
People really want to know. They're grasping for this. I mean, there's so few people like you, Dr. Feinerman, out there with the information that whenever you present anything, they're there, with their eyes open, their mouths open, and you're finding that. I want to just give you information. I forgot. Wait a minute. So the information for them to call you is should we do the 941-592-6613? Is that a good number?
That's a good number.
941-592-6613. It's very, very important that you make that phone call, and then you'll be able to visit him. And it's the 1011. Is it the address in Wellington?
My office is located right by the Wellington Hospital on Forest Hills Boulevard and 441.
Yeah. Right, and his website is easy. It's called Stem Cell Genetic Med, stemcellgeneticmed.com. We're very fortunate to have Dr. Feinerman here working on these kinds of issues. So, Dr. Feinerman, are other doctors jumping into this, or are they still being very shy? They don't know enough. Where are they going to learn it the way you have?
Well, it's, you have to be in love with this field. I get frustrated. I can't believe it when I, speak to doctors like you mentioned about the nephrologist right by me, and I said, I can make you the most famous nephrologist in the country. You're only 38 years old, and no, there's no one in your field doing this. I came up with a a patent and a treatment for another condition besides chronic kidney disease. There's a condition called polycystic kidney disease, which is a genetic disease, and it forms hundreds of vacuoles inside and cysts inside the kidney that eventually destroys the kidney and its function. And I was able to come up with a plan in which we introduced an agent called immunoglobulin A, which was able to penetrate the cyst and destroy the cyst. And then at the same time, that was followed by giving that very same patient the mesenchymal stem cells. And so, there's just so much. People with heart disease, children and young adults that suffer from autism, multiple sclerosis, children. When I was a very, very young man and practicing medicine at the Mayo Clinic, I was fascinated with cystic fibrosis. And it took me over 50 years later did I come up with a successful gene and stem cell therapy. People with lupus, people with Crohn's disease, ulcerative colitis, and men go through different stages in their sexual function. Obviously, as young men, they're able to work and have good erections and sex, but as they get older, they start leaning on Cialis or Viagra. Even that starts not working. Few will drift over to an ED clinic where they learn to give themselves injections, but those things can be painful, and the penis gets red and swollen, and so it's not that really that much of a pleasant thing. But at the same time, we've come out with using the nitric oxide gene, the endothelial cells and stem cells to restore a 70, 80, or 90-year-old man's penis to function sexually in a natural way, and without taking any injections or pills or anything which probably don't help in the first place. But the most interesting field that's yet to be fully developed are eye diseases, particularly things like macular degeneration, which is so common as people get older. We're talking about, millions of people in this country, and certainly hundreds of millions of people around the world, and where we can safely introduce retina pigmented epithelial cells and neural cells. And if there's a genetic cause, we can introduce that. That's with the retinitis pigmentosa or Stargardt's disease. But what you're most commonly going to be faced with is worrying about, as you age, getting macular degeneration, which can be caused by simply the aging process or exposed too much to bright sunlight or other things. And we've entered into the another area somewhat just analogous to the stem cell, and that's where we treat people who've got advanced cancer, no matter what it may be, and often with typical cancer patients, they're treated with surgery, with radiation, or chemotherapy. Chemotherapy can be an awful experience for people have to go through and make people terribly ill. But if a person's has done all these things and yet they still have cancer, we offer immunotherapy for cancer, in which we simply strengthen the patient's own immune system, their T lymphocytes, their natural killer cells, their dendritic cells. And so that's another area that we welcome patients to our office.
Well, I'm so interested in what you do. So if someone has cancer and you locate, of course, where the cancer is, you're saying that you can literally, I don't know how you're injecting this. You said that you're using maybe a person that comes in and then puts the stem cells where they are. But you're saying, how long would that take? Let's just go through the procedure. How long does it take for the stem cell to go in if someone's doing this for you?
Oh, well, I mean, if
we look at an hour?
Oh yes, but I should add that this is the one area in which one treatment certainly not going to be enough, and it's usually going to be repeated like every 2 weeks or once a month for a period of 6 to 12 months. Obviously, if a person's got a brain tumor, we want to get those stem cells right up into the brain, and we do it intrathecally, just through a lower spinal tap, which is another aspect of it. But the experience with immunotherapy has little or no side effects, and what we're doing is we're not introducing foreign things into you. We're creating and increasing the lymphocytes and the dendritic cells and the natural killer cells that you've got in your body, but increasing it 10 times to 100 times so that it will take over some of those residual cancer cells that are floating around in your blood or in your brain.
So when someone says that they were told that they have total cancer, let's say in their liver, you are saying then that you can literally take the stem cells and the liver can be rejuvenated?
Oh, well, the liver is one of the main organs in the body that is very good at regenerating itself often. You can take half a liver off someone in a surgical procedure if they've got cancer, and that liver will regenerate. But you may also get tumors that will then come into that new portion. So to prevent that, the cancer immunotherapy in that instance will be very effective. Yeah.
Are you doing this on pets at all? Is there stem cells being put into pets?
Well, it's interesting that you say that, because ever since I was 8 years old, I used to ride horses. I did jumping. I did dressage primarily. I rode thoroughbreds. I rode Andalusians. I rode Morgans and Arabians and so forth. But my biggest love were the Andalusian stallions. And what disappointed me was with the veterinarians. I wasn't impressed with the scientific methods and techniques that they used. And sometimes they would put a horse down when he foundered, where he just got a lot of blood collecting in his hoofs or something. It could be a $100,000 horse that you can have founded that was all eating too much hay or grain. And but ironically enough, it was the veterinarians who jumped into the field of stem cells long before doctors even ever heard of it, And especially where I live in Wellington, you can see vans and trucks in that area with the big word stem cells on it. And so the veterinarians have jumped into that. I'm assuming that they also have treating dogs and cats with stem cells. Yeah.
Well, Dr. Feinerman, all good things have to come to an end. I want to give your phone number again because we do plan on having another seminar, and you'll have to ask Dr. Feinerman for that information. But call him at 941-592-6613, 941-592-6613, or go to his website, which is stemcellgeneticmed.com. And let me just tell you that we're very fortunate. It's rare to have someone of his experience and his compassion to help people. So if you have any problem that your doctor has said, well, there's not much hope, call Dr. Feinerman. Sit with him. Let him help you with this. I have so much confidence in him. So thank you very much, Dr. Feinerman. We will talk to you another time, and make sure that you look at the of course, he always writes a column in the Boomer Times, the June issue. You'll see where he wrote about Alzheimer's, memory loss, and dementia. Very important article.